My daughter Sparrow had an ear infection. I called the pediatrician after hours, got a call back the next morning, and they said they could get her in about a week. I said, I'll just take her to urgent care, and then they responded, bring her in at 4 p.m. At 4 p.m., we waited for 53 minutes. Now, after our appointment, I asked the doctor, why the long wait? And she said, we have a 10% no-show rate. And sometimes it goes as high as 20%. So, today, everybody happened to show up, so you had to wait. Tomorrow, nobody's gonna show up, and we'll end up losing money. So, that evening, I thought, now wouldn't it have been cool if we could have actually waited from the couch and then checked in via mobile? Also, wouldn't it have been cool if Dr. Rathke could have sent us a delay notification? What about if we could visualize where exactly we were in a virtual queue? Now, the cool thing about the appointment was that it was essentially a standby appointment, which I think is the missing ingredient in what I like to call no-wait healthcare. Now, before we get into solution space, I'd like to just plot out our current healthcare experience. So, primary care, it takes us on average 21 days to get in for an appointment. Then once we get in, on average, we wait for 23 minutes. A trip to the ER, on average, turns into a 4-hour waiting ordeal. And we've seen all these urgent care clinics popping up, so we can get in day of, but we still wait. So we've designed Standby Health to leapfrog that entire waiting experience. I'm Ben Picard. I'm co-founder of Standby Health and pioneer in no-wait healthcare. I was fortunate to attend Yale and Duke, and then start and sell a couple of technology companies in San Francisco. My co-founder, Dr. Dennis Abrams, he's a PhD at the University of California, Berkeley, and he actually is an operational efficiency expert who built up a company that he sold to Warren Buffett. And then we've got a couple of rock star LAMP stack developers, Roger Plichta and Michael Golden. Now, in getting this venture off the ground, we knew that we were going to face compliance hurdles and funding hurdles, so we enlisted the help of Michael Escadel of Fenwick West with our eyes towards a Series A, JC Sambana of Silicon Valley Bank, their life sciences division, and then Chris Plickard of MetaRev, who knows how to scale a digital health company. In his own, he took to $30 million in revenue. Now, I'd like to look at this from an entirely different perspective. Let's look at it through the eyes of the doctor and how they see patients. So, 46% of us show up to our appointments on average 11 minutes late, and then 10% of us, we don't show up at all. So, what Standby Health allows a doctor to do is backfill those no-shows via standby appointments. What's it worth to the doctor? $100,000 per doctor per year, straight to the bottom line. There's 700,000 doctors in the United States. That's a $70 billion market. Now, from our perspective, like what it boils down to is how long is my wait? So we put that information into our phones in what we call a virtual queue. And then we've even allowed ourselves the ability to check in and see exactly if the doctor's running late. And this whole system, it allows us to wait from anywhere, wait from a coffee shop, which is just smart in particular for parents out there. But what's smart for the practice managers that we serve is that there's no change to their existing workflow. What Standby Health does is simply snaps in between a practice management system and an appointment reminder system via an HL7 interface and turns those systems into an automated rebooking engine. Now, this patent-pending approach opens us up to a lot of partnerships with distributors. And some of these are some of the biggest healthcare companies that are out there. We've signed a business associate agreement with Cerner. That's a $5 billion company. They've got 27,000 facilities that they serve. And then Stericycle, we're in integration talks with them. And they've got 70,000 doctors. And any of these distribution partners could end up being an acquirer. Regarding competition, Telebox is the big company out there. They do appointment reminders. We do appointment reminders. In Quicker, they do mobile check-in for healthcare, as do we. QLess, they do virtual queues for a number of different industries. We do virtual queues right now for healthcare. And then where we really pull ahead is in our standby appointment functionality. Now, $99 per doctor per month is more than competitive, and it's easily recouped if just one standby appointment is booked. Just ask any of our early clients. Truman Medical Centers in Kansas City, we've generated an additional $3 million in revenue for them this past year. Jefferson County Health Center, ECHC, and Children's National in Washington, D.C. And with just these clients, we're cash flow positive. Last year, we brought in $200,000 in revenue. This year, we're aiming for $1 million in revenue. And then, at that point, we're looking to scale geometrically. 3 million, 9 million, 27 million. In a similar fashion to Demand Force, which several years ago sold to Intuit for $424 million on revenue of $27 million. And they started out in the dentist industry, and then they expanded into a number of other verticals. So we do recognize that healthcare is big. It's one out of every $5 in the American economy. And so we're focusing on that right now. It's a $70 billion market, as I said. But with just a slight pivot, turning this into standby.co, we've already secured the standby.law, standby.auto, retail, etc., domain names and extensions. And overall, the amount of time wasted in lines by these types of service industries is $130 billion. Regarding fundraising, so today, MetaRev, they're based in the Midwest, they put in $150,000. Jumpstart Foundry, based in Nashville, Tennessee, they put in $150,000. So we have 300 in so far, and then we're looking to raise an additional 200,000. And we're going to be using that for continued product development and then expanded business development, in particular through hiring a VP of sales. Then come next year, we'll start to turn our focus towards Series A. So I'm pretty stoked about the growth and the adoption that we've had so far and the prospects for the future. And really welcome the support of the Monterey community. Thank you so much for the opportunity, Monterey Startup Challenge. For me, this is very personal. So I'd like to take us back to the original story and how it should have been. The way the story should have been and can be with Standby Health is it was 8 p.m. in Monterey, California. My daughter Sparrow had an ear infection. I got a standby appointment for 8 a.m. the next morning at the last amoxicillin. By 4 p.m., she was at her first cello recital, showing all the telltale signs of perfect pitch. Thank you so much.